Hi everyone. So today we're going to dive into a very unique herb or spice that we normally use in our kitchen, and that is garlic. Now we all know about garlic and is used in seasoning our food, and sometimes some even has discovered that it has some very beneficial properties for our health. Now, do you know that garlic has been shown to improve your health? But beyond that, some people say that there is no science to back it up. Some swear that garlic has a natural alternative to treating your hypertension or even people that have chronic kidney diseases. Now, for that issue, we're going to now talk about it. That is it a myth or is there a science behind it? So first of all, let's talk about garlic. Garlic has been used for centuries as a flavor booster in the kitchen, but do you know that garlic also has some proven medicinal properties? Yes, garlic has been shown to one, lower your blood pressure. It has been shown to also reduce your cholesterol levels, and not just your major cholesterol but the bad cholesterol, and it has also been shown to improve blood circulation around the body. Do you also know that garlic is very good for preventing blood clots? That means that it ensures that you don't have clots in the blood when your blood is flowing through the circulatory system. This reputation has led so many people to skip conventional use of medications altogether, especially for those that are afraid of the use of their medications because of the side effects that it possesses. But does garlic truly deliver on these promises? So let's now talk about the promises that garlic delivers on. Now let's look at the science. Garlic contains a compound called allicin, which it is actually released when you cut it or you chop it. This allicin has been shown to have a lot of several health benefits. Now, one of them is that it helps to reduce your blood pressure. Now, studies have suggested that garlic supplementation can slightly reduce your blood pressure when it is used with people with high blood pressure. Then also for the management of cholesterol, garlic may modestly lower the LDL, which is also termed as the bad cholesterol, though the effects of this varies from person to person. Clinical studies have also shown that garlic supplements can reduce the blood pressure to a level comparable to those of some of the blood pressure medications that we use. But now here is the catch. These results often require consuming large doses of garlic, and we know garlic itself has an odor that might not be palatable to some people. Now, that being said, garlic's impact is not a substitute for your medications which has been prescribed by your healthcare practitioner, especially when you're battling serious conditions like your high blood pressure or cardiovascular heart disease. Now, let's now talk about the risk involved when we rely on only garlic to manage your healthcare issues. Now, while garlic has its benefits, relying on it only to treat your heart disease can be risky. Heart diseases are very complex and often require a multi-pronged approach, including medications. Yes, you have to include lifestyle changes like taking a healthier diet, or also improving on your regular exercises. Then also stress management. Garlic can also interact with warfarin and other anticoagulants, meaning that because garlic thins the blood, using it with warfarin can cause an adverse reaction. This means that when you have hypertension and you are on other medications, it can further complicate issues of bleeding when other blood thinners are used, like I said earlier. Skipping prescribed medications in favor of garlic can lead to uncontrolled blood pressure or high cholesterol, which can increase the risk of heart attack and other complications. Garlic alone cannot address these risks effectively. So let's now talk about the right way to include garlic into your diet. So you want to include garlic in your diet, but you also have some issues. So that doesn't mean that you should abstain from garlic. It just shows that you must know how to balance taking your garlic with your medications, because just taking garlic alone cannot replace your medications when you're on your heart health journey. When used as part of a balanced diet, garlic can be very heart friendly. Now, here are some of the tips you must imbibe by when you want to introduce garlic into your lifestyle. First of all, eat it fresh. Crushing fresh garlic and letting it sit for a few minutes before cooking can help maximize the allicin content. Then secondly, adding it to your meals. Now, when you want to prepare your stews, your vegetables, or even your dishes like your let's say rice, you can slice garlic into it. It will promote healthy heart conditions. Then the third thing is, when you want to also take, maybe you're someone that you don't like the offensive odor, or the odor of garlic might be overpowering for you, then you can consider supplementations. So if you're going to consider garlic supplements, make sure you speak to your doctor first, because like we said earlier, taking garlic with other blood thinning medications can increase the risk of bleeding. The other segment we're going to discuss now is balancing natural remedies and medical care. So now you have to know how to balance it. If you're going to be taking natural route to your healthcare conditions, you have to ensure that you seek medical direction. You can't just say you want to take your garlic without also putting in place orthodox medicine. So garlic can be part of your health, your heart health lifestyle, but it's not a magic bullet. Regular checkups, knowing your numbers like your blood pressure number, your cholesterol value is very, very key if you're going to even imbibe by taking garlic. And also follow your doctor's key advice. Garlic has a place it plays in heart health, but when it comes to hypertension, it is a partner, not a replacement. So you can't now say that because you are taking 1 clove of garlic a day, you now stop your antihypertensive medication. The key is balance. Combining natural remedies with evidence-based treatment for the best possible outcome is what we are looking at. Remember, health isn't about choosing between natural remedies and medications. It's about finding what works best for you with the guidance of a trusted healthcare provider. If you found this episode very, very useful and very, very educative, don't forget to subscribe to our channel, share it with someone that it might be of benefit to. And if you have questions or other topics you'd like us to cover, kindly reach out to us on our other social media platforms. And also you can send us an email. And until we see you next time, stay healthy and stay informed.